Hi everyone, Dr. Michelle, and I'm here to introduce one of the series I'm going to be doing live called Trauma Talks. And we're going to be going over physical and mental traumas that we experience in our lives and come up with effective and wonderful ways, powerful ways to deal with that. So I'm going to go through my little list here. Talking about both physical and mental trauma and how it can affect our lives, because trauma can show up differently for each one of us. We will share personal stories and discuss powerful and effective ways to move through these traumas. I treat a lot of trauma in my practice with acupuncture, Chinese herbs, also essential oil therapy, auricular ear seeds, wonderful for addiction treatment and weight management, food issues, also stress, depression, some really wonderful brain points on our ears. So I've been treating trauma in many different modalities in my practice, and I really do enjoy it. So that's something that I'm going to be sharing on Trauma Talks. I'm going to be sharing some personal trauma stories in my life and how I dealt with those. It could be also negative and positive, but I want to focus more on the effective ways that we could go through and really take on trauma and move through it with a greater grace and ease, and really have some great trauma tools in our toolbox to pull from. So there's two different traumas that I broke it down to: physical trauma and mental trauma. So physical trauma can include injuries that we experience, post-surgical diseases, prescription medications, and I included that because we can get a physical trauma from taking a cocktail of Western medication prescriptions. Um, we can have a lot of untoward effects. So I wanted to put that in under physical trauma. Also, abuse of ourself and others harming us, and this could be physically, sexually, coming under the physical trauma. Mental trauma can affect many areas of our lives. We can ask ourselves, how do I respond to physical and mental trauma? Do I feel helpless? Do I feel like a victim? Do I self-sabotage? Do I hide out and isolate? Yes, I do. Getting better, getting better. Do I look for solutions? I do love that one because that's just solution oriented is always great. Do I ask for help and guidance? Do I reflect and meditate? Do I move or not move? And I look at that a lot in Chinese medicine because we look at depression as really a stagnation of qi, of energy not moving. And so we always want to get our patients up and moving, exercising. So mental trauma can really stop us in our shoes, and our internal dialogue can really muck things up. So let's see, other causes of mental trauma can include loss of a loved one, and this is pets and people, because pets I know are, for me, and I know many other people, are like our family and our children, especially if we don't have children. Growing apart from friends that we've had, intimate relationships, love relationships, breaking apart, loss of a job, and loss of your home. So there's many losses that can come under mental trauma. Physical health conditions, poor surgery outcomes. I'm going to be talking more about this because this is a big one for me. In fact, I've thought of writing a book about this experience that I've had over the many decades of my life with post-surgery outcomes. Diseases can really affect our mental health. Prescription medications could also muck with our mental cognitive functioning, and then aging as well can really create some mental trauma. Lifestyle choices and poor self-care can also affect mental trauma, such as drug, alcohol, food, digital devices, sex, gambling, addictions. I kind of put all those under the category of addictions, but there's so many more addictions out there. But having the addictive behavior and the addictions that we fall upon um, kind of as an escapism can really create more mental trauma than actually diving in and just dealing with really the underlying cause. Sleep deprivation, which is a huge one, because I know so many of us are walking around sleep deprived with sleep issues, and that's something that I treat a lot. Poor diet, also focus a lot on that for my patients. Lack of exercise, feeling overwhelmed with activities and responsibilities, overtaxing ourselves and overexerting ourselves, and not really having that balance of fun, play, and work, kind of maybe going overboard in one area. Usually for me, it's work. So what can we do to stay empowered and unstoppable in these times? Creating a plan. We can do some research, which can really empower us. We can come up with solution-based ideas and approaches, which will give us more power around a seemingly powerless situation. Staying active, staying social, balancing activities and rest, which I just talked about, doing self-care, and then taking on care and taking on care with other health professionals. So like myself, I talk to my patients about this, is really creating a health care network, support network that you feel really comfortable with, that helps support your physical and mental well-being. It's good to have other parties helping us and supporting us and guiding us. We cannot do it all. So, and it might be counselor, psychotherapist. For myself, my health care team, which I've shared with many of my patients, is primarily on the alternative medicine areas. So I have my chiropractor who I've seen for probably 20, 30 years. My acupuncturist who I saw over 30 years, however, he retired on me. So I'm seeking out a new acupuncturist. And then I have a longtime masseur who I've probably been seeing for 30 years. So I pull on those three networks regularly, like weekly, to support myself. And then I do my own self-care, which is getting into my infrared heat sauna, sleeping on my infrared heat chakra crystal mat, taking my Chinese herbs, doing my essential oils, doing my exercise, staying on board with my nutrition, and really listening to my body, how food affects my body, and really tuning in. And so this is what I also help my patients do, especially through telemedicine. We can do a general consult, or we can focus on one of those areas such as nutrition and really dive deeply depending on your health conditions. So that about covers introduction to trauma talks, and I'm hoping that we can get some, guests along the way to start coming in and sharing their traumas and how they dealt with them effectively and maybe not so effectively, and helping one another grow and get ideas to help us flourish through our lives. So if you do want to share a trauma and be part of Trauma Talks, please email Dr. Michelle. That would be at michelle@designedtoheal.biz, and that is in my YouTube description. and also in my website that you'll find in my YouTube channel. So please reach out. You can also put in a comment and then put your email in, and then I can email you back, and we can have you come on live and discuss your trauma and ideas and solutions, etc., that you used. I am navigating on this new platform doing my live, so please give me love if you want to reach out and you're an expert at this doing live videos. I'm using StreamYard as my new way of doing these, so it's exciting. I just have a lot to learn. So in the meantime, I'm just putting out content and being here for you all. And we're going to start talking about trauma talk. So please, everybody, take great care of yourselves. Reach out if you need me. You can find me at www.designtoheal.biz. And then I also put my website in, like I said, into my YouTube channel, so you can reach out that way. So wishing you all peace, light, and love. And I'll look forward to seeing you on the next live. So stay tuned. Okay, ciao for now, everyone. Many blessings.